Well, we're glad we get to show you a robot room. It's pretty cool to come into our OR. This is our new wing. I should just introduce myself. I'm Dr. Sukin. I'm the medical director for robotics for Methodist Woodlands. Started doing robotics 18 years ago. And so to see this come to fruition is like a dream for our patients and for us surgeons and the access of care that we can provide. We are one of the only centers in North Houston that has a pod like this that has robots in each room. So it's not just one center, so our whole area and wing has robots, so we can have multiple surgeons working at the same time to be able to have access to this technology. So we'll let you all come in and we can sort of move these arms and manipulate them as we attach them onto the patient's, for urology, abdomen. And then back here is actually where I work. So the surgeon doing robotic surgery works in this console, and it has a couple little instruments. I would call them like joysticks and foot pedals to control all of this. It's no more robotic surgery than it is driving your car. You have to be a good driver. Everything with your stick shift and clutching, all that happens with robotic surgery. We're proud to announce that Methodist Woodlands is the first hospital in the Woodlands to be a center of excellence for robotic surgery. This is much thanks to Methodist Hospital, the commitment of our robotic committee, our physicians. We really worked on making this a center of excellence. We are not just a center that does urology. I'm a urologist. Some centers focus on one specialty. We are multidisciplinary here. We do thoracic surgery robotically, heart surgery robotically, gynecology, bariatric surgery, which is a surgery for patients who are overweight, urology, I won't forget that, general surgery. I can tell you in my years of being a urologist, this is not our first robot, just like cars have changed over the years. This is at least our third or fourth model, and I started using the first model. On the first model of robotic surgery, it was really just for urologists and some simple gynecology procedures. That's all that could really be handled with that. And now as we come to this generation called the XI robot, we're able to do complicated urological procedures, thoracic procedures, bariatric surgeries. What's been able to enable us to be able to do more complicated surgeries as the robot has new generation, new technology is nowadays we can use different instruments that were not accessible before. We have instruments such as staplers and vascular clips. These are what the arms look like as they kind of get put on like that. And we're able to use vascular staplers where the surgeon in the console is able to staple across bowel or even lungs coming across that tissue. And it's really revolutionized the ability to do minimally invasive surgery. So our patients have smaller incisions, their hospitalizations are significantly reduced, their pain is reduced, and they get to go home sooner and get back to their regular life faster by having this technology.
Too, that we've got multiple screens where physicians and the team in the room can better. In a regular OR, you're not going to see built-in radiologic equipment. You have to pull the equipment in, and it's not nearly as advanced, and it doesn't, integrate.
So I'm Thomas Lowe. I'm one of the vascular surgeons here at Houston Methodist. I was actually the first vascular surgeon up in Montgomery County. We've since added another one up here, which is really exciting, obviously, because we've only been here now 2.5 years. When I got up here, we had an excellent hybrid room, which is operating room number 9. And it allows us to do a lot of things that really we could only dream of about probably 5 to 10 years ago. But this is the latest and greatest in hybrid technology. You won't find anything like this pretty much anywhere in the world except in the medical center, which we have now ported up this way. The medical center was actually the first to get the latest in the Siemens operating room, the hybrid operating theaters, and I believe we're the first in the community actually to get this latest version. What's really special about this room, I don't know if you guys have had a chance to speak to our neurosurgery colleagues, but it has a biplane, which allows us to take x-rays in 2 different dimensions at the same time. which I don't personally use. The neurosurgeons use that extensively, though, and allows them to do a lot of the things that, again, they could only dream of probably about 10 years ago. For me, as a vascular surgeon, we work on the blood vessels that are pretty much everywhere that's not the heart or the brain, so a lot of neck, arms, chest, legs, things like that. The big thing that we've been focusing on, though, at this hospital are pulmonary emboli, which are blood clots that go to the lungs, so one of the most dangerous things that one can have coming into a hospital. And so this space has really revolutionized taking care of that type of problem. We are, not to brag a little too much, but the world leaders in taking care of this particular pathology at this particular hospital in the Methodist system, not in small part because of the operating room and being able to use this type of facility. The ability to get into these rooms very quickly is obviously very important, but once we're here, we're able to get blood clots out of people's lungs usually within 30 to 40 minutes, which is pretty much unparalleled anywhere. But this particular space is where we do that now routinely. While I was out actually last week, my partner actually did 4 of them in 1 week, this little tiny community hospital, which really tells you how much of an impact a small hospital like this can have when you bring in that type of technology to this area. What else can I tell you about this place? Let's see. Everything you see here is literally the latest and greatest. The table itself is all carbon fiber, completely see-through in terms of X-ray. It's designed to be basically manipulated from afar, so there's a very large control panel. If you looked at a normal operating room, you have a little tiny controller that typically sits near the anesthesiologist that can move and yaw in different directions. That control panel can do everything but launch basically a nuke from. It literally does everything as far as controlling the arm as well as the table, but allows you to do actually a full CT scan on this operating room table. So from a neurosurgeon standpoint, from a vascular surgeon standpoint, we don't need to transport patients in, right? We can do absolutely everything we would ever need in terms of imaging in one location. So when you think about advanced stroke care, when you think about advanced pulmonary care, you think about advanced aortic care, it really allows us to do things that, again, was unfathomable even when I was training in the last 10 years or so. The other big bright spot in this room is the AV equipment. Something that really we've realized here at Houston Methodist is incredibly important, is really being able to show what we do, but then also explain what we do to people. Right? It's one thing to write it in a textbook, it's one thing to draw pictures of it, it's another to actually see it in front of you. Not a big fan of live cases personally, but being able to record cases in high definition and then explain to people, this is how we do it, this is why we do these different things, is really an opportunity that most people don't get to do as far as being able to share how to take care of people and really lead that cutting edge in taking care of vascular and neurosurgery patients. Otherwise, it's a fully functional operating room, so it functions the same way that any of our others would, but with a lot of that technology really layered on top of it.
In room 9, they can actually do a heart. So just as an idea, when Dr. Lowe was talking about what those were capable of, our original hybrid, it's heart capable. You can go in there to do something minimally invasive, but say it's unsuccessful or the patient doesn't do well. They can actually crash that patient on the table and be able to continue surgery in that room without moving them. And in former years, you would have to move them from one place to the other, wasting time, perhaps wasting brain, if they're not getting circulation. So these are all huge changes that weren't available just not that many years ago, but a lot of investment because all of this is quite expensive.
I'm Dr. Eric Price. I'm the director of the joint program here at Methodist Hospital, and we are a center of excellence in joints, hips, knees, shoulder, and spine. And we are the only certified center of excellence in Montgomery County. And about a year and a half ago, we started adopting the newest technology in joint replacement surgery, and that's the Zimmer Rosa robot. The traditional way of doing a knee replacement is with cutting guides that are manually done by the surgeon, and over the years, we're pretty good. We're not perfect, but we're pretty good. And with the addition of the Rosa robot, what it's allowed us to do is increase the accuracy of our knee replacements. It's a tool. A lot of people think that the robot is doing the operation. It's not doing the operation. It's a fancy tool that really helps to allow the surgeon to convert the feel that we would always do with a knee replacement to objective data. So traditionally, if I'm doing a knee replacement, I would put guides in and I would feel the limb and I would say, okay, that feels pretty good. It may feel a little tight, it may feel a little bit loose. But what the robot does is it guides our cuts based on what information we put in, and then it turns my feel into objective data. So if I say this feels a little bit tight, I can now look at a screen and say that is tight, and I can make adjustments. So when I get done doing a knee replacement using a robot, I leave the operating room and I know that limb is straight, I know what angle it's at, I know what the ligaments feel like. And that's the key to a good knee replacement. We're really trying to get the soft tissues to balance so the patient can have the best range of motion and best stability. And this is some of the latest technology, and I was going to demonstrate how this thing moves around. And so people don't think that the robot's doing it, the surgeon is the one that's actually doing it and making the choices. It's just a tool to help us do our cuts.
I waited on the pins, so I didn't
Okay.
let you do that. We got a wire driver on there, they're
Okay.
ready for you.
How much time do I have to kind of show y'all stuff? This is the actual robot, and this is an articulating arm. That's a camera that is watching the whole operation. So I'm going to put in some tracking pins. Go up a little higher, higher, higher. So when we start this operation, go up higher. When we start this operation and push in, we have to set things up in a certain position. So this is where the robot would normally live. This is where the camera is going to live, and then I'm going to watch on the screen what I'm doing. So the first thing that we do, we're going to run through the registration.
You're right, we have to put the pins in.
All right. So this would be on a patient. A patient would be in a position similar to this, and I've got exposed bone. And so this is a sawbone. Okay. So inside the patient's incision is where these go. We don't have to make a separate incision on the thigh. Where's that finger? Thank you. And so these are what's known as the tracking guides. So they're going to follow the leg in space and move with me if I move the leg. The nice thing about this patient is there's no blood. Okay. So this whole process of putting the pins in takes approximately about 5 minutes. So there is a little bit of a time added to these operations. About 15 minutes total, but I think it's worth it because this is supposed to be a left. So I think it adds, because of the accuracy, it's worth it. So here at Methodist, I've done about 200 to 220 of these. You got the screws. And I haven't had a single leg fall off. What do y'all have left to do in the OR tour?
This is our last topic.
Is it?
You're the grand finale.
Yes.
If y'all
Dr.
could,
Price, how many joint replacements have you done over the past 5 years here?
over 1,000, most likely. I don't know the numbers. I know that we looked at our robot knees. So you have to get everything lined up. This camera has to see these arrays, this array, and the robot, so it knows where in space this limb is. So I can set this, if I want to cut it at an outward angle, I can do it within half a degree.
That's amazing.
Okay. So normally when we're doing a knee replacement, our goal is to end up with a straight limb instead of being bowed or knock-kneed like what we start out with, and a straight limb where all the forces are going through the limb when they hit heel strike and walk, and then be able to bend up 120, 130 degrees and be stable throughout the range of motion. That's the goal.
Do patients usually stay real immobilized, or do you have to do secondary stuff to immobilize the leg?
We move them immediately.
Yeah.
70% 50% of our patients go home the same day
Well,
now.
I don't mean afterwards, I'm talking about while all this registration stuff is going on.
They're asleep on the operating table.
Yeah, and they're not jerking around or anything?
They're totally asleep.
Okay.
They don't feel any of what I just did.
And a lot of this is happening while he's making his decisions.
Yeah, they're anesthetized. I do my incision, I do my exposure to open up the knee joint. And the computer needs to know where the center of the hip is, because we're trying to align the whole limb down. So what this does is, as I move this hole around, it's going to find the center of the hip. Because the goal is, again, to have total alignment all the way down.
And
then what I'm doing now is I'm just taking landmarks of the actual bone. And normally I'm on the other side. Where's our femur? So we're just mapping out the bones so the computer knows the size, where it is, and where everything is in space. Okay? So this is something we wouldn't normally do in a hip. So it's actually tracking this whole limb and what it's doing. So I would start out and I would see where I begin. A lot of people come in, they've got a stiff knee. And I may start out with a 15-degree contracture where they don't come straight, and I'll know that they're bowed. So like that's not uncommon. I've got to correct that to 0 and 0. And it gives me the ligaments, these are the ligaments, it gives me that tension of what I start with. And then what I do is I make a plan. And then I'm going to follow the plan, and we'll show that. So the arm will follow it. See how it's moving like that?
So it'll always be on and never misses.
Right, it doesn't miss. It will move immediately. And so I would then pin this like that, and then I would make my cuts. And then when I'm done, I pull this out, and then we proceed on. It does a lot more than this.
And it's a one-stop shop for them. They can come here, they register immediately with us, so they don't have to go register somewhere else, another part of the hospital, and go somewhere else. So it's convenient for them because they're also bringing their baby with them as well. Visitor that comes in does have to go through the front desk. They ring this bell, and we're able to let them in from here. Once we enter into the postpartum area, we do ask that all visitors do hand washing. This is just to help, again, another way to protect our patients from any infections that could be coming in from the community. Yes. So this is where they'll stop and do hand hygiene. Then they'll come to the front desk and they'll check in with our secretary to get a badge. Again, just for safety reasons, everyone needs to be identified within our unit. A little bit different than the normal floors is our patients do get a little bit softer sheets. So just for provided comfort, there we do have special linen for them. That's allow the parents to have a little bit closer experience with their infants. Our old ones, you couldn't put them underneath the bed, but these swivel, and so it allows the mom to be closer to the baby. Also for any patients that have C-section or they're having a C-section, sometimes it's harder for them to lift patients, so they're able to, there's a safety feature here, and they're able to drop this down. And again, it pops up on its own, another safety feature of that. Again, it swivels, it goes up and down. We do allow for our parents to stay the night, the dad to stay the night, so we provide them with a couch. And then also, again, this is also convenient for them because they can roll that over there and have access to their baby as well. Then the twin room is a nice feature because when we have twins and because we are a private area, it allows us to open up the doors, so these doors completely open, and it makes essentially one big room. And so the parents can still stay together, provide support for each other, and not have to be in separate rooms. And then they can also bond with their families together because we're able to put the babies and the mom like next to each other if they were going to do kangaroo or provide kangaroo care.
I'm going to take you and walk you around the department. You know, care teams have to work together. It's not just nursing, they're not just doctors, it's everybody. There's nutritionists, there's pharmacists, there's everybody. And so there's literally a table in the middle for everybody to get together to meet, to talk, and to plan out every single patient's care. And so we really like having this area there and open for everybody to see and for everybody to be involved and comfortably fit. So one of the things that you can see is that this board right here actually helps us to track in real time how a patient is doing. It uses multiple data points from the patient's chart and lets us know, is somebody getting better, is somebody getting sicker, is there somebody that we need to jump in and do something for right away. So this board comes up, and I'm not going to make you stay in here forever, but every 2 minutes it flips actually to another monitoring board. Yeah, something that we're real proud of, which is called Responder 5. So each of our rooms has a special call bell system, and when the patients call, they use Responder 5. Well, we've partnered with that company to bring about kind of real-time data monitoring. It's a nice room, it's a spacious room. One of the things that you'll find different than a general medical, surgical, or acute care room is we have monitors, state-of-the-art, top-of-the-line portable monitors, so where we can monitor what's going on with the patient. These decks actually slide out should we need to bring the patient along to a procedure or test. All of their info is attached. We can do simple vital signs, blood pressure, heart rate, respiratory rate, up to very intensive monitoring should we need to at this bedside. This is important because patients that are a little sicker, like intermediate care, nursing is giving very particular medications to the patients, and often you want to be staring at a cardiac monitor while you're giving those medications, making sure that the effects are not something that we need to address quicker. One of the things that patients are always looking for is some place to charge their cell phones or their iPads or their computers. We have attached to the table. It's a little thing, but they can charge directly there. The other thing that we did in the pandemic, really across the Houston Methodist system, is we invested in this iPad project. It's something that we thought about and talked about for a long time, but it went into rapid overdrive when COVID hit because we weren't having visitors in. And patients wanted to see their families and families wanted to see their patients. And so it's evolved to the point to where we now have one in every single patient bedside. And in these new rooms, we actually have the tablets on pivotable arms where it can't be released and they're ready and set up. What's great about them is they can log in securely to these iPads. They can log into Netflix, iHeartRadio, whatever it is that they use. These are set with our documentation system actually, so when a patient is discharged from the hospital, it automatically blanks it. It clears it. It does a factory reset. So no personally identified data stays on the tablet. So they can feel confident to log in and use those services. The other thing that's on here that we like the most is they have MyChart. MyChart works with Epic, and they can actually keep track of what's happening to them while they're in the hospital. They can see their labs, they can see doctor's notes, they can see radiology tests. They can also order their meals. This is a big win because traditionally in hospitals, it was if you've ever been a patient, it's pick up the phone and wait on hold until somebody can answer and then talk through what you need. Well, that is all built in and ready to go here.
So we actually on Monday just opened our outpatient wound care clinic in our second medical office building. We also are expanding into Kingwood and just opened at Kings Harbor. We have outpatient physical and occupational therapy, sports medicine, and we will also have rotating group of specialists that go out there as well as primary care. So again, thinking about how do we really connect with the entire greater Montgomery County and North Harris County population and meet the needs of that community. Additionally, we are continuing to add imaging capacity down in our imaging department as a part of our backfill renovation project. So lots going on.